My name is Samantha Backhaus. I'm a clinical neuropsychologist at RHI. Mainly, I start out my service by doing a lot of evaluations, we call neuropsychological evaluation. How I explain it to patients is that we're going to be taking a kind of a tour of your brain today. And it's not going to be painful. There's no machines, there's no needles. It might even feel like you're in a therapy session. And what we're doing is we're looking at all their cognitive functions, a little bit of intelligence, a little bit of attention, rate of processing speed, memory, problem solving, language, and so forth. And then we also look at mood, how they're feeling, and we might give them a personality test. So we're trying to really assess the areas that can be impacted by any brain injury. The patients that are that we see, first of all, is that they would have had some kind of brain injury, and it can be any kind of brain injury. So whether it's a concussion or a severe traumatic brain injury, stroke, anything that really affects the brain functioning. And the ones that most typically benefit are ones that have these goals where they're not just coming to therapy and working on their arm functioning, right? They're working on their cognitive functions in therapy, and they're trying to get back to doing their usual duties, parenting, working, right? School, driving, all that stuff. I'll meet with the patient about a week or so later, and I'm going to go through how they did on the report as well as all those recommendations. Once we finish that process, some patients I will go on to see on a weekly basis. Some patients I'm going to see every other week. Some I might not see again for a couple of months. It just depends on their level of need. We have had some patients that got back to working, and I mean as physicians and attorneys and accountants and very, very high-level positions. They have returned back to working, but even the ones that have returned back to working, driving, they're fully independent again, it may take them a couple of years to do that, and then, sometime in that year or two, the first year or two, they may be able to do that. But even they might be left with a few lingering issues that they're gonna want support over. In addition to doing the individual therapy, RHI developed 2 different group therapies, very intense. Each one is 16 weeks. So one of them is called Brain Injury Coping Skills Group, and we call it BICS for short. And so we get the patient and we get a family member, a trusted loved one, and teach them about what's happening to them, the expectations for their recovery, what to expect in different phases. Then we give them all kinds of strategies to deal with the neurobehavioral things, and then we give them all kinds of strategies and stress management skills to deal with the emotional things, because that's why it's kind of a very lengthy session, and those families can benefit from each other. They can benefit from learning off of each other and having that support. And then we also developed a 16-week marriage group called Couples Care. So it's very specific to helping couples get through this process. And when you treat their behaviors and their mood, and you treat their families, and you treat the spouse, and you kind of be as holistic as possible, the success rate dramatically increases.